At Forefront TeleCare, our mission is to overcome the logistical barriers of providing psychiatric care to residents of rural nursing facilities by using video technology to make it possible to deliver high-quality care from our locations to yours. I've seen for myself that with the right technology, supportive staff at the nursing home, and real-time technical support by the Forefront team, psychiatric telehealth works extremely well. Residents improve, staff find their job satisfaction better, and families are grateful that their loved ones are receiving this specialized care. Our values include the desire to provide high-quality psychiatric care with an emphasis on teamwork and improved quality of life for both the resident and the staff. And our values include the belief in the importance of non-pharmacologic and behavioral management strategies for patients with dementia-related agitation and aggression. It has been our experience that facilities in rural areas have really never had access or resources to have an integrated behavioral care program. With Forefront, that is exactly what we are able to deliver, a completely integrated behavioral care program. Our doctors become part of your interdisciplinary team, allowing you to have consistent care week after week and month after month. This is exactly what most facilities need to foster compliance with CMS regulations. Behavioral care is appropriate for all of your residents that are on psychotropic medications, some of whom may just need to be seen for a quarterly review, while others may need a monthly or more frequent check. There will be some residents that are candidates for gradual dose reductions who may need to be seen weekly. With Forefront's solution, you have the assurance of a specialist that will follow your residents so that they receive the very best care possible, and that your facility is taking steps to ensure that care plans are followed. To launch our program successfully, I suggest you gather a list of all residents on psychotropic medications as a place to start. Even better, see if the list can be organized by drug class, since antipsychotics are so highly scrutinized. There may be other residents not currently taking psychotropics who may also be appropriate for referral to our provider. Obtain referrals from the residents' attending physicians, realizing that a brief reason for the referral is important, as is the intention for us to assess and provide ongoing treatment. Sending face sheets to Forefront for insurance verification is critical, as is regular communication with Forefront for schedule changes and other scheduling issues. Other tips include having the resident ready and in the session room on time, as well as letting the provider know whether previous recommendations were followed and whether any new medical issues have emerged since the previous visit. With back-to-back sessions, certainly having the next resident ready in the wings will help our providers maximize the time they have to spend with each resident. Nursing home culture has been far too medication-focused, and with rates of antipsychotic use skyrocketing, others have taken notice, including the public and Medicare. In 2012, CMS targeted a 15% reduction in nursing home antipsychotic use, and the targeted reductions will likely increase over the coming years. Our providers must do what they can to foster this notion of how best to manage dementia-related behavioral problems by defining target symptoms, ruling out medical causes, searching for unmet needs, addressing environmental factors, educating your staff, recommending behavior management strategies, and avoiding pharmacologic toxicity. By partnering with us, we hope that you will also think more seriously about behavior management strategies and person-centered dementia care. We realize this is a work in progress, as culture change is never easy. There are unique advantages of our providers seeing your residents through our telehealth solution. For example, the fact that your staff member is always present for the session will help keep our providers informed about what the key issues are, whether progress is being made, and whether their recommendations are being followed. There are even opportunities to have a family member come in to spend a few minutes interacting with our provider during a visit. To conclude, I want to welcome you once again to the Forefront family and make myself available to you and your attending physicians and medical directors as a resource both clinically and logistically as you move forward in the process of what I hope will be a mutually positive relationship.